One of our main things is to help reduce restraints, because if you have restraints, and certainly there's times to use them for the patient's own safety, but the goal should be a restraint-free facility. But the problem is, some facilities use restraints all the time, whether they're chemical or physical. And so they may not have the patient restrained for the JACO survey, but the patient's restrained for the other 1 3/4 years. And so this is a great way for us to appropriately look at these patients and help figure out, how do we minimize the likelihood of restraint? How do we make the patient cognitively better? Because the more cognition they have, the more interaction they have with other people, the less likely they are to have complications. And so that's our main purpose. That's our goal. CareGuard 360 is when we come in, and we come in once a month, and we look at every single person, every single patient in the nursing home, every single patient in the assisted living facility. Now, the patient's family can decline us and say, look, I'm just not interested. And that's fine. But realize that's an affirmative defense for you. Because if the patient's family says, I didn't want CareGuard 360, and then something does happen, look, you offered an additional service. We were looking for pressure sores. We're looking for complications. That's fine. If they don't want it, they don't want it. Nobody's forcing them to have it. But it gives them peace of mind. And it says, hey, somebody else is coming in as a third party and taking an extra look. So if I can't make it there this week, if I can't make it there this weekend, if I can't make it there this Wednesday, somebody else is at least double checking on me. Somebody else is verifying that somebody's, that there's no fecal contamination, that the bedpans are being changed, that somebody else is paying attention to the whole facility. Somebody's measuring the temperature in the water. Somebody is making sure that all the certifications in the kitchen are okay. It doesn't have to be on a daily basis. These certifications don't go bad in one day. You can predict that the facility is going to need to have their ServSafe updated next month. So let's get ahead of it. Let's identify the issue and figure it out before we get to the point where next month comes and no one's been looking on that wall and that certification is out of date. So CareGuard 360 is literally us looking at the patient head to toe, side to side, front and back, and identifying any potential issues that could cause problems. It's also allowing us to collect the urine sample and the sample for communicable disease if there is an issue. And at the same time, we're in there with the patient. There's so much that you can't tell unless you're actually physically in with the patient. I found this out when we were doing a lot of remote therapeutic monitoring and a lot of telemed. You don't get to smell the patient, so you have no idea what's actually going on. And not that I want to sniff patients, but the reality is that sniff test is really important, because that's going to tell you what the phenols smell like. That's going to tell you what the facility smells like. I was shocked at how much more information you gain just being in the patient's physical presence rather than doing this by telemed. When we have complicated patients, it's really hard to do telemed now, because you want to be there. You want to take a look at the frailty of the patient. You want to see how they're moving. You want to see what else is in the room. You can't do that through the view of just a video screen. And that's why we send people in who are specifically trained to look at these. And each patient gets a little file report. That file report doesn't go to their chart though. That file report, if there's an abnormality, goes as legal work product. And then the attorney can make a decision, hey, what needs to happen? And they're not going to look at everything because they don't need to. 99% of the time, everything is perfect. And it doesn't rise to the level that needs an attorney intervention. But occasionally it does. And that's what gives you protection, and it gives you advanced knowledge so that you can make a change. So it's both visualizing the patient, front and back, side to side, feet, head. It's smelling. It's taking the picture of a wound to identify what it looks like, the size of it, and if there's an ecchymosis or bruise. It's not taking a picture of the whole patient. It's just that limited area with a centimeter marker on it. So we know it's the sample collection that might be necessary, whether the patient needs monthly blood testing for routine testing, or whether they need a urine toxicology test or an STD test, or whether you're trying to figure out if the patient has a urinary tract infection. All of these tests can be done at the same time. And it's also definitely to look at their feet, because if you don't, you're going to miss something. And a lot of times podiatrists don't necessarily show up. And sometimes the podiatrist does show up and they're trying to do way more than is necessary. And so that's the other thing. You want to make sure that nobody's doing something too much and finding wounds that could have easily been tiny and them suddenly getting bigger. You want to make sure that you're doing everything you can, because if patients have problems and they're amplified unnecessarily, that reflects poorly on the nursing home. And when we're doing all this, one of the big problems in nursing homes simply is loneliness. And so this is another interaction that the patient is having with somebody who cares, somebody who's asking questions, and it gives the patient the comfort to discuss. And we can elucidate, what are the good things about this and what are the bad things? And when we elucidate those good things and those bad things, we can report them. And at the same time, we can video some of the information that the patient's transmitting, and you can use that as a way to share the experience of that patient with potential other people that might want to come to your nursing home.